Hello, everyone. Thanks for joining the first of three preparatory webinars for the 2020 Leadership and Advocacy Conference Advocacy Day. This webinar will provide an overview of the policies you'll be discussing during your meetings with federal lawmakers and their staff on Capitol Hill come March 24th. There are many of you on this call who may have never advocated before, and others who are more experienced advocates. And this webinar is designed to give you a detailed overview of hospice and palliative care policies, putting it in layman's terms so that you can effectively and comfortably advocate on Capitol Hill. This will not be the only time we discuss the policy priorities, so don't fret. There will be a policy overview during our training sessions on March 23rd, as well as time where you can practice your congressional meeting techniques with your state delegations. Additionally, a recording of the slide will be made available next week, so check back on the Advocate Prep Center sometime then. I wanted to actually begin by introducing you all to the Hospice Action Network team. So the Hospice Action Network is the 50C14 affiliate of NHPCO. Basically, we are the lobbying and advocacy arm of NHPCO. And NHPCO can only engage in a limited amount of lobbying because of its tax status. Thus, the Hospice Action Network was created. Pictured here, we have Hannah Yang Moore. She's in the black blazer. We also have, she's our Chief Advocacy Officer, excuse me. We also have Mark Slobodian, who will be talking later today. He's pictured to the left. Lauren Drew, she's in the middle center here. And then myself, Sydney Shepard, is to the far right. We are your federal lobbyists. Last year, we took over 500 congressional meetings, so we're constantly on the Hill advocating for you all as providers and also caregivers and patients as well. So some of the policy priorities we will be discussing today are outlined here. So here's a bulleted overview. They kind of fall into three different buckets. One is kind of expanding access to hospice and palliative care. Another is reducing regulatory red tape, and another bucket is ensuring program integrity. So the Palliative Care and Hospice Education and Training Act, which has been around for some Congresses now, would fall under expanding access to hospice and palliative care. It's a workforce funding bill aimed at increasing the amount of trained hospice and palliative care professionals who will be prepared to meet the needs of America's aging and growing population. We have the Rural Access to Hospice Act, as the name suggests. It is also under the expanding access to hospice and palliative care bucket. It centers around ensuring that patients in rural and underserved communities have equal access to hospice and palliative care. We also have hospice program integrity legislation, the Hospice Care Improvement Act, which was recently introduced in November of 2019, and also the Helping Our Senior Population in Comfort Environments Act, also known as the Hospice Act, which was recently introduced around 2 weeks ago, actually. Additional supported legislation, which will not be your main focuses, but if you have enough time during your congressional meetings to discuss these topics, are the Provider Training and Palliative Care Act, which also falls under the Expanding Access to Hospice and Palliative Care bucket, creating opportunities now for necessary and effective technologies for Health Act, which is the CONNECT Act. It's actually a telehealth bill aimed at ensuring that patients can be recertified via telehealth. And lastly, strengthening innovation in Medicare and Medicaid Act. That is basically what we will be discussing today. If you have any questions, there will be time at the end of the presentation for you to ask those questions. So moving on.
All right, hi everybody. This is Lauren. I'm the Senior Manager of Advocacy and State Relations, and I'm going to be tag teaming this with Sydney today. So the slide before we were just looking at might be overwhelming for some of you. I do not expect you to memorize or remember, even if you remember 10% of what we talk about today, you'll be all right. We're going to go over it again when you get to DC. And like Sydney said, there's a couple things that are more important that we're going to ask everyone to bring up in their meetings. And some of those other bills, we're only going to ask some of you to talk about. If it's your first time, you're going to focus on PCHETA, you're going to focus on the Rural Access to Hospice Act, and anything else is gravy. So really just those two main bills. So let's dive in a little bit. The Palliative Care and Hospice Education and Training Act, like Sydney said, has been around for a while. We're really happy that this bill passed the House last year. So when you're in your Senate meetings is when you're going to be talking about PCHETA. And what is PCHETA? It's a workforce bill. So it does a lot of things, and we have a one-pager on PCHETA on the Advocate Prep Center. So if you haven't had a chance to take a look at that, that's going to be your deep dive into all the specific things that PCHETA does. But for what you really need to know, PCHETA is going to improve workforce funding and education for healthcare providers to make sure there's enough people trained in hospice and palliative care to address the needs of our aging population. There's grant funding and fellowship money and a PR component. All of that stuff is in the one-pager. But for you, it's going to be a workforce support and education bill to make sure there are enough hospice and palliative care trained professionals to address the needs of an aging population. So where is PCHETA in the process right now? Like I said, it passed the House, and we're going to be talking about it mainly in our Senate meetings. Now, if you have a meeting with the Senate Health Committee, that's a very specific committee, or the Senate Finance Committee, those are going to be the most important offices to make sure you're talking about PCHETA. And we'll give you a list. We'll let you know if you're taking any of those meetings. Because basically what we're trying to do right now, PCHETA was supposed to go to what is called a markup, and that's just when the committee that has jurisdiction over the bill goes through the bill, makes any changes they want to make. Sometimes they're hearing testimony about the bill, and that didn't happen. It was supposed to happen in the fall. They had recently gotten some commentary about the bill from the Health and Human Services Administration, and there wasn't enough time for them to address that comment before the bill went to markup. So we're hoping that we're just trying to keep this bill on their radar. They need to hear from constituents like you, from advocates like you, that this bill is still important. It's important to our community. It's important to our patients, and that we want them to keep focused on it and get it to another markup, hopefully sometime soon. There we are. The bill is led in the Senate by Senators Tammy Baldwin and Shelley Moore Capito. You'll notice it's a Democrat and a Republican. All of our bills are bipartisan. We try really hard not to pick sides. We are happy to work with any member of Congress that is supportive of hospice and palliative care. And that's something that we'll go into a little bit more in one of our other webinars. But we do work very closely with both sides. We are non-political, non-partisan, and you'll be taking meetings with both Republicans and Democrats, depending on where you're from. As of February 18th, the Senate version does have 37 co-sponsors, so that's great. That is a sign that the bill is moving and is popular. So that's what you'll be asking your senators to do. You don't walk in and ask them, pass the bill, because one senator can't pass a bill all by themselves. We will be asking the senators to co-sponsor PCHETA. The more co-sponsors you get on the bill, the more powerful and popular the bill is, the more likely that they will take action to move it through the process. As I mentioned, it has broad bipartisan support. It is heavily supported by various organizations. We are not the only group supportive of PCHETA. I'm sure some of you are involved in some other healthcare organizations that are also supportive of PCHETA. We're happy that we have about 52 different healthcare organizations that are supporting and lobbying on this bill. So, the more the merrier, and the more support we have, the better likelihood we have of moving it. As I mentioned, a little bit of information there about the markup. It ended up not making it to that fall markup, so we're hoping that we can get it there this spring with all of your help. Next slide, please. Great. So the Rural Access to Hospice Act. This bill is a lot smaller than PCHETA. PCHETA is a huge bill. Like I said, there's a lot of people on it. It's gotten a lot of press. It's very popular. The Rural Access to Hospice Act is small, and it basically fixes a quirk in the law that currently, if you're a patient at a rural health clinic or a federally qualified health center, because of the way that physicians at those providers are paid, they cannot serve as your hospice attending physician. And this is just a stupid quirk. It has to do with when FQHCs and RHCs were created and the Medicare hospice benefit wasn't a thing yet, so they couldn't include it in the list of things that those providers can do. This came to us from one of our advocates in Kansas, actually, many years ago, who found that there were patients, specifically in rural areas, that were not accessing hospice because they could not keep their trusted physician. So we've been working for years. We started working through CMS, and then we found out it was a legislative issue. So now we've been working through Congress just to change this quirk. It is not a controversial bill. It is also a bipartisan bill, and it's bicameral. There's a bill in the House and a bill in the Senate. So this is a bill that most offices you meet with should have already heard of. We've been working really hard to get in and meet with all the offices. If you joined us for Advocacy Day last year, we were also working on this bill. So it shouldn't be a shocker. Maybe if you have a new staffer in the office, but it should be something that they're aware of. And again, your role as the advocate here is to tell them it's important to you as a constituent, as a care provider, and it's important to patients in your district. That is the thing, you know, the difference between having a professional lobbyist come in and tell them versus having an actual constituent make the schlep all the way from your home district to come all the way to Washington to talk about the bill. It just weighs more. They value that more than when a professional lobbyist comes in. So that's really your job. In the House, it's sponsored by Jackie Walorski, Republican from Indiana, and Ron Kind, Democrat from Wisconsin. And in the Senate, it's also sponsored again by Shelley Moore Capito, Republican of West Virginia. She's a big champion of ours, so shout out everybody coming from West Virginia. And Jean Shaheen, Democrat from New Hampshire. The big news on rural, and hopefully you all saw this on our action alert, is that we did just get a cost estimate from the Congressional Budget Office. Now you're going to look at these numbers and some of you might think, oh my gosh, that's a lot of money. But $5 million over 10 years is considered pennies in the federal budget. We were very excited to get a score that is that low. You might even find that when you tell congressional staffers that that's our CBO score, they might chuckle because that's basically lunch money. That's a really great sign for us. That means that the bill can move without there being a giant funding fight. And we're hoping that that's what's going to happen because we've already received technical assistance from CMS. That's another hurdle that offices might ask you, well, does it have a CBO score and does it have technical assistance? And for the Rural Access to Hospice Act, you can say yes on both accounts. The main issue with this bill, as I said, is just that it's tiny. We're hoping that it's going to ride along with something else. There is a package that we are hearing that might come together in May that's going to have a lot of different healthcare stuff on it. So a lot of the healthcare stuff you might be hearing about in the news, you know, it's probably all going to get wrapped in to a package that we're hoping moves in May. And we'd love to get this bill attached to it. It's a small bill. It's a bipartisan bill. It's got a low CBO score. It's got technical assistance. It is ripe and ready to go. We just need to make sure the members of Congress hear from you all that this is important to you and that you want them to do it. Great. Oh, do I see a question in the chat box? Nope, just a hello. Yes, please feel free. If you are joining us via Zoom and you're using the chat box, feel free to chime in. Let us know you're here. You can ask questions there, or we will actually unmute you all at the very end and you can ask questions that way too. Okay, so the other bucket of legislation is hospice program integrity legislation, and this does require a little bit of background. So hopefully most of you know that in July 2019, the OIG put out 2 reports that were pretty bad. Let's be honest, they were awful. One identified serious deficiencies in hospice performance and quality, and one outlined like specific awful incidents where patients were harmed. So you can imagine this, you know, just lit up everybody when it came out, and we've been working really hard ever since it dropped to convene our standing committees and put together a list of 13 different program integrity measures that fall into big categories of transparency, oversight, and education. So thank you so much. I know some of you do serve on our quality committee, our regulatory committee, and our legislative affairs committee, and those were the 3 committees that worked really hard throughout the summer to put together these provisions. And so we were lucky enough to be able to take these provisions directly to Congress. We have a great relationship with our congressional champions. And, you know, they basically asked us, they were like, all right, you know, these reports are awful. They affect your community. What are you going to do about it? And we were right there with our 13 program integrity measures. And we've been working with them ever since to get those program integrity measures turned into bills. And we're generally happy that a lot of what we suggested is in both the House and Senate hospice program integrity legislation. Next slide. So the Senate bill, let's start with the Senate bill. We generally like the Senate bill a little bit better than we like the House bill. And I'll get into that in a minute, but just keep that in mind that of the two of them, if we had the luxury of being the final decision makers, we'd probably pick the Senate bill. The Senate bill is the Hospice Care Improvement Act, and it incorporates a lot of what we had in our program integrity measures. There's a survey and enforcement procedures, increasing the reporting of the data, ensuring that the data is available to consumers in an easy to understand format, and improving the survey process by requiring education and competency for surveyors. Now, if this is an issue that you are super into, I can give you all the details and you can read a giant pile of information about it. We kept it real brief here. If you want to hear more about it, just email me and I can give you all the nitty-gritty details. Next slide. So where is it in the process? It was introduced by Senators Rob Portman, Republican of Ohio, and Ben Cardin, Democrat of Maryland, in November, and it is with the Senate Finance Committee for review. So again, if you're meeting with someone on the Senate Finance Committee, this bill might come up. We'll let you know. Things are even changing on this right now as we get there. So what might happen between now and when you're actually in that office remains to be seen. So if it's something we want you all to bring up, we'll give you all the updated information when you're actually in DC on March 23rd. Next slide, please. Great. So what's the House bill? The House bill has this wacky name. I really think there is some staffer in every congressional office whose job it is to come up with acronyms. And this one's a bit of a stretch, but they got there. It's the Helping Our Senior Population in Comfort Environments Act, also known as the Hospice Act. And again, we're generally okay with some of the provisions that are in this bill. There's, again, survey and enforcement procedures, increased reporting of the data, making sure the data is available in an easy to understand format, improving the survey process, all that stuff is in there. There's just a couple points that we have some issues with, and that's where it differs from the Senate program. It includes a special focus program, providing additional support and enforcement to hospices that fail to meet the conditions of participation. Okay, that's not bad in and of itself. We do have a problem with the increased surveys because the Senate bill is very specific about who would qualify for increased surveys. House bill says everybody is going to have to do surveys every 24 months. And we've heard from a lot of you that that's going to be a huge burden. So that is something that, depending on what happens between now and when you get here, might come up in your meetings. Additionally, the House bill includes civil monetary penalties as a possible sanction and suspension of payment for all admissions as things that could happen to programs that have poor performance. Again, this is something that is not in the Senate bill. We do prefer the Senate version. And if, depending on what happens between now and when you get here, it might be something that comes up in your meetings. We will give you all the updated information when you're here. This is just more of kind of background FYI. The Senate bill also asks for a GAO report on the effectiveness of the remedies. And we're okay with that because if they're going to make us jump through all these other hoops, we want to see a report that says whether or not it's working. But just so you understand, the program integrity legislation in the House and the program integrity legislation in the Senate are not identical. With the Rural Access to Hospice Act, they are. They are word for word identical. You can talk about that bill the same way in the House or the same way in the Senate. But for the program integrity bills, they are different. You'll notice they're not named the same, and they do have very specific differences between them. Again, if this is a topic that you're really interested in, you can email me and I can give you even more information about the House and the Senate bills. Next slide. So the House bill, sorry, I forgot to go over where it is in the legislative process. It's a Panetta and Reed bill. So Jimmy Panetta, Democrat of California, and Tom Reed, a Republican from New York, huge champion of ours, hospice volunteer. We're big fans of Congressman Reed. He's done really well by us. And this is new. I mean, this was introduced February 10th. They had a markup 2 days after it was introduced, which is almost unheard of in terms of how quickly that happened. And that tells you that this is a major priority for that committee because, you know, other bills take years to get to the markup. This took 2 days. So it's hot, it's moving, it is late breaking news. And again, there will probably be changes by the time you all get here. We do have a CBO score that means it's a saver. It's going to save money. There are provisions in this bill that, you know, it's going to be used as a cost saver, which again is great if you want the bill to pass quickly. It shows that the staff is really focused on this and they wrote it in such a way that it would save money as opposed to cost money. Always harder to pass bills that cost money as opposed to passing bills that save money. And because this already passed the markup, it's ready for a full House vote. It could be scheduled. We don't think it's going to happen before you get here. If it does, we will certainly let you know, but it's probably, again, something that will come up in your meetings when you're here. Next slide, please. All right, so the ones we all talked about are the main priorities: PCHETA, rural, and program integrity. Those are the big ones. The rest of these bills, while still being important, you know, I don't want to send you guys in there having to ask them to do 12 different things. We really try to keep it simple, so we're not asking you to memorize 8 different bills and 8 different bill numbers. Again, if there's a bill in here that you're super hot about and you really want to talk about, we can make it happen. But if not, just focus on PCHETA, rural, and program integrity. So let's talk about some of the other bills that you might hear about. The Provider Training and Palliative Care Act is a really nice little bill. It's Senator Rosen and Senator Murkowski. Senator Rosen, big champion of ours in the Senate. And this bill, it's very tiny, but it does an important thing. And hopefully some of you are familiar with the National Health Services Corps. It's a program that awards scholarships and loan repayment to primary care providers who go into needed disciplines and needed areas. And it's really an access program, making sure that people can get access to care in underserved areas. And so they fund people to specifically go work, go study things and then go work there. And the bill would add palliative care to the list of things that's eligible for this program. So, you know, small bill, but would do something really important. Right now it's only in the Senate. Thank you. It's Senators Murkowski and Jackie Rosen. It's only in the Senate. It is in the Senate Health Committee. And what we're trying to do in terms of helping out Senator Rosen and Senator Murkowski is we're trying to find them a Republican and a Democrat in the House so that we could get a companion bill. So in your Senate meetings, feel free to add, you know, that this is a bill we'd like their support on. But also when you're in your House meetings, if you're meeting with someone who seems really interested in our issues, you know, they're really passionate about hospice and palliative care and they want to do more, you know, let us know, because maybe that office wants to lead the House version of this bill. So just keep that in mind when you're talking to your House staffers. If someone's really interested, this is a bill we could suggest that they lead, especially for some of those new House members. Leading a bill is a big deal. So that could be considered a really nice offer to make to them if we pair them with a bill that needs a leader. So next one, creating opportunities now for necessary and effective care technologies. But yeah, okay, it's the CONNECT Act, another one of those interesting acronyms. This is a really big bill, and there's just one specific provision that addresses hospice that we're interested in. So it's got a whole lot of stuff about telehealth in all kinds of different care settings, but there's a very specific provision that allows the use of telehealth for hospice recertification. This could be huge for our providers who have to spend so much windshield time getting to and from patients, but there are still some restrictions. So telehealth could happen, but there would still need to be a provider present with the patient for this process. So, you know, we're supportive of it. We're interested in expanding the use of telehealth and helping mostly in our rural providers, but really anyone, again, some of our patients have mobility issues, so telehealth really does have a lot of opportunities. But because this bill is so massive and only one little part touches us, it's not necessarily on our high priority list. Next slide. This is a bipartisan bicameral bill. It's been around for a while. It is very well known as the flagship telehealth bill, but the main issue, it's introduced by Mike Thompson, Democrat of California. The main issue, though, of the telehealth bill is that there's so much in it that it really never moves by itself. It tends to go kind of piece by piece, a little bit here, a little bit there. This might get incorporated into a different package. This might get incorporated into another package. I don't think you're actually going to see the entirety of the bill go all together. So we'll keep an eye on our part of it. We'll see if there's somewhere else we can stick that in. And I just wanted you to be aware that this is a bill that's out there. And next slide. All right, last bill, I promise. I know this has been a lot, but again, these are all just kind of for your information. The important ones were all up front. So the Strengthening Innovation in Medicare and Medicaid Act. This bill basically is designed to improve the function of the Centers for Medicare and Medicaid Innovation, known as the Innovation Center, known as CMMI. It was created under Obamacare. And there have been some questions about how it's being funded and what kind of models is it working on and how are decisions being made over there. So this bill is really about monitoring and just keep putting some guardrails around what they're doing and making sure there's transparency and input, advance notice. It doesn't really, affect us specifically, but because we do have some models over at CMMI, some of you might be involved in, it could. So we're keeping an eye on it. We're interested to see where it goes. Next slide. Next slide. Thank you. And it's, there's also a rural component to it. But the main part I wanted to get to was it's a Terry Sewell bill, Congressman Terry Sewell from Alabama. And I think, Adrian Smith, Republican from Nebraska, Tony Cardenas, Democrat from California, John Shimkus, Republican from Illinois. So again, another bipartisan bill. I don't believe there's a Senate version of this bill yet, so this is just something to be aware of in the House. But it is something we're keeping an eye on. Again, more just FYI for you. And if models and CMMI is something you are particularly interested in, again, email me. We've got other stuff we can send you that goes nitty-gritty details on some of the stuff coming out of CMMI. But for the rest of you, just be aware, if you see this on some of your materials, it's, something that if you get a question on this bill, you can tell them we're generally supportive and then just refer them to us. And we'll talk about the details ourselves. So, okay, everyone breathe. That was a lot. For those of you who have come to Advocacy Days in the past, that's like the highest number of bills we've ever thrown at you. There just happens to be a lot going on right now in the hospice and palliative care community. We are busy. So let's go over again the basics. What is the priority legislation? This is where you should spend 99% of your time. If you only talk about these bills, it's a successful meeting. Don't even worry about the other stuff. So on your Senate meetings, it's going to be PCHETA, it's going to be the Rural Access to Hospice Act, and the Hospice Care Improvement Act. We'll see where that is by the time you guys get to DC. For the House, PCHETA's already passed the House, so you don't have to worry about PCHETA in the House. It's the Rural Access to Hospice Act and the Hospice Program Integrity Hospice Act. We will have more information on those program integrity bills because they are moving, but what I can tell you for sure, Senate is definitely PCHETA and definitely rural. House is definitely rural if you want the absolute bare bones. Okay? All right. So then everything else is kind of just gravy. The Provider Training and Palliative Care Act, that's the one that involves the National Health Services Corps. That's only in the Senate. We are looking for House sponsors, though, if anyone seems interested. And then in the House, the CONNECT Act, that's the telehealth bill. And the Strengthening Innovation in Medicare and Medicaid Act, that's the CMMI bill. Again, if your head is spinning, don't worry about it. But if you're interested, if you have specific interest in any of these and you want more information, just email me and we can send you more in-depth stuff. Okay, now we can open it up for questions. I hope we have, good, I did that in half an hour, fabulous, that was my goal. Questions, you can either ask us in the chat box or you can ask me. I think we can unmute people. I think you might also have the option to unmute yourself. I know if you're joining us via computer, there's a button that says unmute me, but go ahead, open for questions.
Hey, Lauren. This is Erin from the Hospice and Palliative Care Association of Iowa. And
hey, Erin.
Hey. Thank you so much for this overview. I think this is fantastic. I did have a question when it comes to logistics of scheduling meetings. I know
Sure.
Last year you had, there was an organization that was scheduling the meetings for us. And I wanted to know, is that going to be the case this year? And if so, in lieu of that, if somebody is interested in scheduling the meetings themselves, can they do that for their state?
Sure, great question. And yes, we do hire Soapbox. They are the people who do the little app and they handle all of the scheduling. I do get that question occasionally that some people want to schedule meetings for their state. I can put you in touch with our scheduler, but I will say it does sometimes cause some logistical issues where if you don't go through the scheduler, we don't get all the information about meetings that changed or different phone numbers or the staffer had to switch out or we have to change the time and the place. So if people are really interested in scheduling their own meetings, we can certainly talk about that offline, but we are paying someone to do that and it should be all handled for you. I do have people who are serving as state leaders, so we will have a special call just for the state leaders, and state leaders will be getting their rosters and advanced information probably about a week before the event. So hopefully that answers your question. But yes, if you have never been with us before, don't worry about scheduling meetings. We have people take care of that for you. If you have a special need, like you have an early flight, just let me know. Or you have a special need, like you went to college with a congressman and you want to meet with them, let me know. Otherwise, it is all handled for you.
Sounds good. Thank you.
Anytime, anytime. Yeah, any questions about anything? Doesn't have to be about legislation.
Lauren, this is Dan Grady. Can I ask a
hey,
question
Dan.
about VIBD? I mean, it's a concern of mine for years. I think it's a lot more detrimental since we in New York have lived under the Medicaid version of this. And I'm just wondering if we're in Washington anyway, and they didn't go along with two of our key proposals. One was to test the damn thing out. And the second was, you know, the payment rates they're offering. I know it's not a legal, legislative thing, but shouldn't we ought to be warning people about this is a very big concern of ours, and maybe they can put a little pressure on CMS?
Yeah, so about that specifically, we didn't put it on the list because it's not, like as you said, it's not quite ripe for legislative action, but I know this is an issue for you, so we can talk offline about the best way of you talking about it in your meetings. Again, if anyone else is also particularly interested in MAV bid and you want to talk about it, we can figure out the best way of doing that. I just didn't put it up there because there really isn't a bill or anything right now that particularly addresses that.
I know, it's just I'd rather complain about it now than after the fact when we got to live with the results. So thank you.
Yeah, no, that's fair. That's fair.
Hey, Lauren, it's Mark.
Hey.
I wanted to echo for those who might be new on the call, the contract of the soap people, they are amazing. And you've used them for probably the last couple of years, and everything runs so smoothly. Everything that you need to put notes in. It's just, I love that process of you guys scheduling the visits for us. And it just makes it very, very easy. And so just want to give that testimonial that I have found it a wonderful process the last few years.
Oh,
I
great.
definitely
Thank
agree
you.
with Marisette. This is Christine, and I say it every year for the repeaters and then for the new people. It's the best thing ever. It's on the spot. You can be updated and you can get all your evaluations and comments in. It's a very, I think it's worth the money, and I appreciate that NHPCO and Han put that much into it. So I think it's a great, great tool. Thank you.
Thank you, Christine. I'm glad you all like it. It's always good to hear back from the advocates that it, you find it to be worthwhile. All right. I'm going to go over a couple frequently asked questions, and if you have any other ones, just please feel free to interrupt me. I had a question on attire. We're going to go business casual. So, ladies, I would suggest not wearing big heels unless you're one of those people who is like so comfortable and can run a marathon in them. God bless you, because that is not me. I usually recommend people wear flats, comfortable shoes. There will be a lot of walking. Yes, there are, underground tunnels and stuff back and forth, but you will get your steps in during Advocacy Day. I routinely hit 15,000 steps when I'm on the Hill all day, so be ready for that. Wear layers. I would also ask, since we have enough time, if you can wear purple. Hopefully you've noticed that the NHPCO and Han colors are generally in the lavender purple-ish family. Don't feel like you need to go out and buy a purple leisure suit, but if you have a purple blouse or purple jewelry, a purple tie, a purple shirt, this would be the time to wear it.
Good to know. Good
yes,
to know. That's a good idea.
Yeah. That way we can all sort of match. I'm going to try and get the hostage buttons again, but I want all the staffers to be like, who are all these people wearing purple? And then we can, oh, we're here with NHPCO. The hotel, we are at the MGM National Harbor. Now, if you're coming for the rest of the Leadership and Advocacy Conference, you might have already booked a room at the Gaylord. That's fine. There's a shuttle that runs back and forth from the Gaylord to the MGM, and NHPCO is also going to have a shuttle going back and forth during peak times. But if you're just coming for advocacy, you might want to book at the MGM. All of the advocacy events are at the MGM. That's where the staff is staying. That's where everything is. So just don't be too confused there. That is where we're going to be. We do have 2 more preparatory webinars that are going to go more in depth about techniques for your congressional meeting, how to be a successful advocate, and logistics about Hill Day, maps of the congressional buildings, how to get through security, all those kinds of questions will be coming up on the other webinars. Yes, the recording of this will go on the Advocate Prep Center, as the slides will too. You can review them at your leisure. If you have coworkers who were not able to make it, they can certainly view it later when they have time. Also, this is not so much for you all because you're already registered, but we are not taking on-site registrations. Everybody needs to be in my system by March 6th, and then we can guarantee you a meeting. If someone comes to me on March 10th, I'll do my best, but I can't necessarily guarantee them a meeting. The closer we get, the less space there is on congressional calendars. And please mark your calendar. I know some of you have to fly out, but if you're staying, the congressional reception Tuesday night is open to the public. So if you have friends in town or family here, or invite the staffers that you're meeting with, it will be a lovely way to celebrate everyone's hard work that day. All right, so any other questions about this or anything else? All right, feel free to rewatch this as many times as you need. Slow it down. I know I talk fast. There are one-pagers on the Advocate Prep Center where you can get a deeper dive into rural and Pachita, as well as our 13-point program integrity plan. I'm going to be putting up a cheat sheet once I get the okay from my big boss that it's good to go. There'll be a cheat sheet up there that breaks down the priority bills versus secondary bills. And then we will have 2 more preparatory. Oh, go ahead.
No, I was going to let you finish. I'm sorry. I thought I heard a space.
No, I was just saying there will be 2 more preparatory webinars. So if you have other questions and you don't think of them today, you do have other opportunities to ask them.
Okay. So mine's just procedural, what you just said about the prep sheet that you're getting, that's in the approval process. Is that going to be the one that you will hand to us on the day for that, when we the leave behind that we leave with the Congress members of Congress?
Yeah, so the one that I'm putting everything on the Advocate Prep Center is for you. It's got your notes, your cheat sheet. You can mark it up, and I would suggest not leaving it with the
Okay.
offices. But you will get your folders that you're actually leaving with the offices. You'll get those Tuesday morning.
So this
But
is
if you
for
want
the
to print out stuff,
preparatory.
yeah, if you want to print out stuff from the Advocate Prep Center for your own edification and review, please feel free. We're going to try and keep most things as digital as possible, but you will get folders Tuesday morning, and you get one folder per meeting. So even if you're a delegation of 20 people, looking at you, California, there will be one folder per meeting. We don't print out anything more than that, but anything on the Advocate Prep Center, if you want to download it and print it yourself, please feel free. All right. Well, thank you, everyone. Any more questions? Hopefully I didn't scare you. It's going to be a great day. It's my favorite day of the entire year, and I'm looking forward to seeing all of you.
Yeah, it's
Us
always
too, Lauren.
fun.
Thank you.
So it's always great. Thank you, Lauren.
Great. Thank you, guys. Have a great weekend, everybody.
Take care. Bye-bye.